So today I'm going to provide you information on hypothyroidism or an underactive thyroid gland. So before we proceed with hypothyroidism, I would like to discuss the basic function of the thyroid gland. So thyroid gland is a butterfly shaped gland that is located in the lower part of the neck, and it produces two main hormones, the T3 and the T4, and depending upon this the thyroid disorders are classified. So when the T3 and T4 is produced in higher amounts, it leads to hyperthyroidism or an overactive thyroid gland, and if the T3 T4 is produced in lower quantities, it leads to an underactive thyroid gland or hypothyroidism. Symptoms of hypothyroidism or an underactive thyroid gland include fatigue, lethargy, weakness, unable to lose weight or weight gain, changes in the menstrual cycle, increased sensitivity to cold, mood changes or depression, hair fall, and dry skin. The diagnosis of hypothyroidism is based on the clinical symptoms. In addition to clinical symptoms, on examination, there might be a diffuse enlargement of the thyroid gland, and your doctor might advise you a battery of investigations to detect hypothyroidism, which include a T3, T4, and a TSH. In individual cases, a thyroid ultrasound may be preferred. The treatment of hypothyroidism includes thyroxine therapy. Thyroxine is a thyroid hormone which is available in the form of a tablet which is to be consumed empty stomach. The dose of this tablet depends upon the age and the weight of individual. This tablet is completely safe. So thyroid and pregnancy. So hypothyroidism in pregnancy is very important, is because thyroxine hormone is essential for the mental development of the baby. Hypothyroid pregnant patients should ensure that their thyroid hormones and levels are optimized according to the pregnancy ranges, for which they need to check their thyroid functions at regular intervals. I personally would recommend that every hypothyroid patient in pregnancy should seek an endocrinologist help in case of any confusion. Hypothyroidism or an underactive thyroid gland is a fairly common condition that affects 1 out of 9 females. If you have symptoms that are suggestive of hypothyroidism, you should seek an endocrinologist opinion who will examine, investigate, and then give you a plan of management.